Good evening, everyone. My name is Caroline O'Regan, and welcome to the RCSI University of Medicine and Health Sciences. This is our 12th Conversation That Matters series in collaboration with the HSE. The topic this evening is COVID-19 telling the story. I'm very pleased to welcome our panel of experts, Dr. Miriam Colleran, consultant in palliative medicine, St. Bridget's Hospice, Naas General Hospital. Also like to welcome Susan Mitchell. Susan is Deputy Editor and Health Editor with the Sunday Business Post. And Dr. John Fitzsimons. John is a consultant paediatrician in Temple Street Hospital and also a clinical director for quality improvement with Moorish Houston, who's a medical journalist with the Irish Times and columnist with the Medical Independent. He's also a health analyst and adjunct professor of medical humanities with Trinity College here in Dublin. Last week, we heard about some of the great work that's happening in few of the vulnerable groups in our society. We looked at prisoners and homeless people in particular. This week, we'd like to switch now to how the story of COVID-19 will be told into the future. Our two journalists this evening, Moorish and Susan, have been reporting and commenting on the COVID pandemic in our national media. We are curious to know what their perspectives are on the pandemic, our healthcare systems and society, and of course their views on the real leadership story. Our talk will finish in about 45 minutes. We have a short opportunity at the end for some questions. If you could please put them in your box on your computer, my colleague Tina Joyce will collate to the panel at the end of our conversation. I'd now like to hand you over to my colleague Miriam and to thank the panel. We are looking forward to our conversation this evening. Thank you, Miriam.
Thanks, Caroline. The COVID pandemic has led to illness, the sad loss of life, grief, fear, risks of job losses, risks to psychological health and well-being, and to the economy. An individual person may not always be aware at the time of the significance of his or her own lived experience. As Rosa Parks said of that defining moment in time on the bus in Montgomery, "I had no idea that history was being made. I was just tired of giving up." TV, print, and social media have played an important role in this pandemic, both internationally and nationally. As George Orwell said, journalism is printing what someone else does not want printed. Everything else is public relations. So Susan, thank you very much for being here today, and I'm looking forward to delving into this further with you. But firstly, what led you towards a career in medical journalism?
Actually, when I started out, initially, believe it or not, I started in sports journalism of all things. When I was at college or at university, I covered hockey for a sports paper, and I just became more and more interested in journalism then to start with, even though I didn't actually study it. I studied English and business and various different subjects. And then I got an internship or a work placement in the Evening Herald and moved around from there. And I just found, even though I tried lots of different things like property, business, current affairs, I even dabbled in a little bit of politics, I was really drawn to health. I just really enjoyed it. I was more passionate about it than any other subject. And so even though I was working for a business newspaper and everyone kept saying to me, "There's no room for health in a business newspaper," Susan, I just really kept plugging away because A, I enjoyed it, and B, health covers so many different things. You know, health encompasses politics, it encompasses finance, economics, business, you know, in terms of pharmaceuticals, and obviously people. So I just felt it had a little bit of everything, and I was really drawn to it.
Okay, thank you. That's very interesting. And I suppose what has been different about medical journalism in the time of COVID and pre-COVID?
Certainly during COVID, I have found it much more fast-paced.
Okay.
You know, because initially I almost found it hard to keep up with the constant new developments, the new studies, the new findings. I was, almost obsessive with the whole subject when the pandemic, first emerged, or just before it was declared a pandemic by the WHO. What I found, I suppose, challenging is the number of, say, preprints that are now being published from a medical journalist perspective. And I didn't study, obviously medicine, and to be honest, I actually didn't even really study science. I didn't study science to a very high level either. So I found that quite difficult, or challenging to say, because a lot of stuff is put out there and then you feel, actually, that's not correct. So to kind of really steel myself not to rush into reporting things online and just to sit back. I'm lucky because I work for a Sunday newspaper, unlike Merge in a daily, so maybe has a bit more more pressures than I do in that respect. So I have had to kind of, I suppose, sit back, wait, and talk to a lot of people before you go to report things.
Okay.
They're the two, I suppose, most significant things that I've noticed around how it has changed pre and post COVID.
Okay. And I suppose then, talking about the communication around COVID, would you like to comment on the framing of language and the importance of language and communication in COVID?
I think language is obviously really important, and communication is really key, especially if you want to bring people with you and bring the population with you. And, I have to say, in fairness to the government or to our political leaders and to, health service leaders and medical leaders, that has happened. There has been a lot of buy-in, I think, from the general public to what has been done. And I think that the language, the communications in the main has been quite good. But as to specific language used, I suppose the most obvious egregious example was Trump's China virus trope, which was, really terrible. And I felt that at a very personal level, because my brother is married to a Chinese woman and lives there. And actually, when the pandemic first broke somewhere, but when it was first declared a pandemic, I had my nephew, who is half Chinese, and niece staying with me at the time. And so, you really felt it when you went outside. And I remember taking him to a park one day, or them to a park, and him saying, "Are there chickens in Wuhan?" There were these girls saying it's Chinese, this virus. And I thought, oh my goodness. So, definitely language is important. I do think that many, Western leaders, and I think we've done it a little bit ourselves as well, have fallen prey to using wartime analogies.
Yes.
And I think it's interesting, because I think Jacinda Ardern has done an incredible job in New Zealand, that they have actively avoided using warlike language, because it just, according to the pieces I have read, instills fear and negativity in people. So I think it's been interesting just to see how people have used language differently. And then obviously you also see Trump, using it in a whole different way, and certain populist leaders. But by and large, I think that certainly the communications here, and with the exception of some of the wartime language that has been used, the battle, the fight, that we have seen here, has been relatively good.
Yeah, and it's been very helpful. Like when some of the Late Show did a lot of evenings in education about COVID and about hand washing, and it was very helpful.
Yeah, it was, and there was a huge buy-in from the media at the start to try to facilitate communications. And as you say, RTE, the public broadcaster, did a fantastic job. I think we had Leo Varadkar on the Late about it, Simon Harris, Paul Reid, Colm Henry, Tony Holohan. So they certainly and they gave people time to explain, as opposed to what you often get, maybe a two or 3 minutes on radio. So people had a bit of time to relax and say their piece.
Yeah. And then I suppose coming to leadership, John F. Kennedy, President of the United States, said leadership and learning are indispensable to each other. What leadership styles do you think we have seen during this pandemic, and what do you think we've learned?
I'm hoping that, the kind of the strongman leadership styles, of the likes of Bolsonaro and Trump, which clearly have not been successful, will damage that type of populist politics and might damage them in the long term. I think it's kind of been interesting to see, both Xi in China and Trump have kind of deflected blame by, attacking other nations. In the case of, America or Trump, certainly he has, attacked China over delays. And as I said earlier on, in reference to the Chinese virus. I've also thought it was interesting, just at European level, I was disappointed at the start to see just how insular many leaders became, especially with regard to personal protective equipment. When people were trying to keep it for themselves and not allowing any to be sent over, to your nearest neighbours or to members of the EU even. That was quite interesting, and you have seen that kind of insularity, thought, and indeed action seep in a way that I haven't really seen it before. Just as, we have taken very little interest in what's happening in Hong Kong, or certainly the EU has, because I suppose leaders are just so immersed with what's happening with COVID-19. But I think, there has been some great examples of leadership here. Whilst, I might be critical in some ways of aspects of how things have been managed, most especially the fact that it's been very difficult to extract the science behind the decision making. I found that quite frustrating, actually, and something I should have maybe said about, working as a medical journalist during COVID. But, I think the chief medical officer has shown brilliant communication skills and also good leadership, and has been a very kind of steadying influence throughout this.
Yeah. So I suppose so how do you think we'll look back at COVID, say, in 5 years' time?
No,
or maybe even longer.
Even longer. That's a really hard question, because I would have thought that it would completely change our approach to so many different things. But I know, and maybe this is a more of a reflection on me than anyone else, that I know the things that I'm thinking about are, God, I really miss not being able to travel. And that is a very, very first world problem. I totally understand that, but you feel very hemmed in. But I don't get a sense that societally we're thinking of bigger picture issues. So I was surprised in the Irish Times poll to see where climate action rated. If any, I would have thought that because climate action is, or climate change is such a huge threat to our very existence, possibly even more so than COVID-19, that people would have said, well, gosh, like, we were hit by a pandemic, we were told that was coming, but we weren't really as prepared as we should have been. We now really need to start taking action on climate change. But actually, it seems to have fallen off the radar completely for people. So I don't know if it's going to change us hugely, but it's probably quite early to make a call on that. But the climate change one really struck me as quite surprising.
Susan, that was really fantastic, and it'd be lovely to have longer, but we'll have more time in Q&A.
No problem.
Thank you very much, John.
Thanks, Miriam, and thank you, Susan. Murish, good evening.
Hi, how are you?
I'm great. Yeah, lovely to have you here. Thank you. And I suppose we've all become huge consumers of media over the last few months, and I think I have to thank Susan and yourself and all your colleagues, I suppose, for bringing us accurate and important information that's helped us get through all of this. But I wanted to think a little bit about maybe other ways that we tell the story as well, and I think I wanted to maybe for us to dwell a little bit on the idea of narrative medicine and the ideas that it brings in terms of understanding and maybe making sense of all of this, not just kind of the accuracy of what's happening immediately?
Yeah, I mean, narrative medicine is a broad area, and it includes stuff like medical stories in fiction. It includes bibliotherapy, all kind of things. But in the actual practice of it, it's very much about a patient story, and it's very much about having a bridge or creating a bridge between the doctor and the patient. So that whole patient anecdote, where you try and understand someone's illness by listening carefully, and you particularly try and understand how it affects someone's life, in particular the emotional aspects of that. That's probably where we're at in the broader sense of narrative. The other side of this, though, I do think is really important, is that somebody somewhere is, and I suppose I'm excluding journalists when I say this, but somebody somewhere is recording stories, literally just the stories of people who have either had COVID or have lived with it or have been in some way affected by it. And when I say I'd like them to be unvarnished, I think there's a great value when you're taking a story in having it, reading something that has sort of dots and ums and ahs and all that kind of thing, because it's as somebody speaks and tells the real story. So I wasn't able to find any evidence of anyone anywhere kind of making a really big effort to do this. So hopefully it's just that I didn't pick it up when I was doing a bit of research. I know people are doing it like in universities, and if you do a web search, you'll see lots of individuals and individual groups doing it. But I really would love to know that, journalism is the first draft of history, but I do think these individual stories are so important for us for the future, because this is a huge event. I'd put it up there with TB. It's obviously more acute, but I mean, if I want to really get a sense of what TB was like for patients, because I wasn't around at that time, I find that if I read Strumpet City, for example, that really has a tremendous stories, obviously fictionalized by the author, but there is a real immediacy to those stories. So slightly concerned that will happen. I suspect it will, because it's so much easier to collect stories now, not just audio, but video and online and that. So hopefully that will happen, and we'll have the opportunity to look at those.
And I saw in the New York Times, I think during the week, there was a piece saying that, doctors are COVID's first historians. And I think, the importance of what you're just saying, listening and hearing from healthcare workers. And why is that important, that we, whether we tell the patient story or even the experience of the healthcare worker? Why is using story to understand that? Why does it help?
I think it's huge reality. There's a huge, when I went into journalism, I was in medicine first and went into journalism. And I have to say, like Susan, not formally trained in it, but I was very, very aware that I'd been listening to stories as a doctor, but when I began to listen to stories as a journalist, it was a huge realization that there was an enormous depth to these stories, and an enormous power to the stories that patients tell about their illnesses. And that led me then to go back towards medicine bit and think, hang on, is there a way that we can make this more central to what happens between doctors and patients? So it's it's been interesting.
Yeah. And do you think anybody can tell stories? I mean, is it only the gifteds kind of who can write? Or, I often think kind of, how comes all these interesting things happen to some people? But is there maybe a way of looking at the world that helps you see those stories and get into them?
I suppose being reflective is very helpful, and we certainly know that amongst healthcare professionals, reflecting on situations and patients is enormously beneficial, not just to looking after that particular patient, but to our general professionalism, I suppose, for want of another word. But it's, you know, stories really are, I know what you're saying in terms of, you know, someone who's a Shanachie or someone who's well able to tell stories, obviously is able to put it across better. But I think there's a tremendous story from everybody. And often, you know, someone may not be that confident or whatever, but there's a story in that as well, and there's a story in the non-verbal stuff that's going on. So yeah, I mean, the other thing I suppose, just a bit of a bugbear of mine, is the notion that we can take patient stories and turn them into something else. And I'm a little bit of cautious about that, because I think the story belongs to the person and always should belong to them. And we may, you know, interact with that story, but I think you have to, at the end of the day, give it back to the person. That's really important.
Yeah, and we were talking about the importance of using stories in teaching and in learning, and I think this is, the experience of the last few months is going to be a trove really of I suppose, scenarios and situations that would help, I think, students and anybody to learn.
Absolutely. Again, another impetus or importance of recording these while they're fresh, you know, and while they're live. But certainly, you cannot beat listening to a patient, and I think whatever way, whatever part of medicine, whether it's infectious disease like this or cancer care or cardiac or whatever, if you listen carefully to the patient, you know, long before we had CT scans and MRIs, it was reckoned, and I'm sure it still applies, that you can make a fairly accurate diagnosis in 80% of cases just by listening. And then if you examine the patient and you add another 10%, so, you know, the basic stuff gets you 90% of the way, whereas I think maybe we've been seduced, and I know medical students have anyway, been seduced by the, you know, the high-tech stuff, because in terms of knowing exactly what's going on anatomically, for example, you just do your CT scan and you get an answer. But that's actually not going to help you, in my view, make a really broad diagnosis, and it's not going to help the patient choose the right treatment.
Yeah, and I think we're all having to engage with our narrative skills as we do a lot more work on the phone now, and obviously asking people and trying to, you know, use questions and I think not just learn about the illness but about the person. I think as we do that to build up, I suppose, that relationship that we rely on so many other things in normal times. Yeah.
I mean, it'll be interesting to see. I must say, if I was involved in organising healthcare, I would be encouraging a lot less repeat OPD attendance. So, you know, someone has been through their acute episode, but as we all know, people are called back perhaps a bit too much and a bit too long over a long period. All of those consultations could quite easily be done as we are now on a telemedicine type arrangement. So just coming back to Susan's point, what will change? You know, that's certainly something that should change, but will it is the big question.
Yeah, and Susan and Miriam were talking about leadership, I suppose, and I always think, you know, stories have a very important role to play in leadership, I suppose, in trying to really get to the nub of what's important to us. And do you think there's stories here for leaders to use? I was struck a few weeks ago, Paul Reid, who was on the webinar, spoke about unlocking, you know, that the HSE has unlocked itself, and I think we've seen great stories of people, you know, doing innovative and new things and really kind of working outside of their area or collaborating differently. And I think story conveys a lot of that much better than maybe any other way of measuring it.
Absolutely. I mean, you can have all the position papers and, you know, the various structured formats, but really I think a lot of leaders know this. If you really want to get a message across or really want to make an impression, you tell a story first, and maybe you tell a story last as well. I've been impressed, hugely impressed by the HSE's ability to, and I hope I'm not upsetting anyone when I say this, but shall we say it might have been known for a certain amount of torpor up to now, and then COVID comes along, and suddenly people are taking the reins and really making good decisions and acute decisions, and probably sticking their necks out a wee bit in terms of, not waiting for all the evidence, but doing their very, very best. I think the challenge for the HSE going forward in terms of leadership will be to try and harness that and turn that in, that kind of activity and that kind of way of doing things, turn that into how you manage the big tanker that is the HSE in more normal times, or as we come out of COVID. I think they struggled a bit with that, but it would be just amazing if they could translate some of what we've learned from COVID into the management of the monolith.
Yeah. And what do you think we can all do, I think, to become better kind of at capturing that story and using it and then reflecting it? What are the skills kind of that really every healthcare professional should be engaging in and even learning about?
Active listening is the big one, and related to that, don't interrupt your patient when they're initially telling their story. Patient stories are really important to people. They put a lot of preparation to them in advance of consultations. So if they don't get a chance to tell the full story as they see it, I think they feel a bit hard done by. And we're probably, certainly up to a number of years ago, we would have been known for interrupting a bit early, shall we say. I'm talking about the broad profession. Whereas in actual fact, if you let someone run with their story, it rarely goes beyond 90 to 120 seconds.
Yeah.
Which isn't a huge amount of time. Okay, someone might say in a 10-minute consultation, it's whatever percentage of that, but it's so worth listening to that, because you will pick up on so many different things, not just the actual pain or the actual, issue or symptom, but you'll actually pick up on, oh, that really is important to them because, and that then gives you a very different platform and a very useful platform for beginning to engage, hopefully more meaningfully.
Yeah, absolutely. Lovely advice. We had Michael West on, Professor Michael West, a few weeks ago on the podcast, and he had this lovely phrase of listen with fascination, which I thought, it's the dedication to listening, and I think, and to patients, but obviously to each other as well, I think, in terms of really understanding. Thank you, Marish. That's been lovely. I'm going to hand over to Tina, and I'm sure she'll have some questions.
Good evening, everybody, and thank you, Susan, and thank you, Marish. That was really interesting, and we have some really interesting questions coming in as well. So I suppose we'll start with a general question that has come in for both of you, and then there are questions that are specific to each of you. But the first question is, to what extent does your own personal values and belief influence your writing and what you write about? So I might start with yourself, Susan.
Sorry, Susan, your microphone's on.
You need to unmute.
That should be it. Okay. So, as a journalist, I suppose your own views and perspectives on things are really you aim to try and park them, when you're covering different things. So, like, I'm not particularly political, but like everybody, there are certain parties or politicians who I might like, more than others. But you really do try to park that, because it is important that you're seen to be, or that that you're seen to be impartial and unbiased. But I certainly have found myself drawn to certain topics more than others. So I've always been interested, for example, in pharmaceutical pricing, the reimbursement model, what happens. And it's just, I'm not quite sure why I'm so drawn to it, but I have been. So I've been really interested in new drugs coming on stream, whether they get approved. That has certainly probably meant that we have covered that as a newspaper, as a news outlet, maybe more than others might have. But it possibly also reflected the fact that we're a business newspaper, and therefore, you know, a lot of the companies involved were pharmaceutical companies. But I don't think my own, you know, I don't think it hugely influences what topics I decide to cover, I have to say. Hopefully, you know, it makes me go about things in a fair and balanced manner, and you know, we try and avoid kind of the sensationalism that can sometimes, you know, that people are often critical of the media for that. We try to avoid that as best we can, but yeah, I don't think it does usually, to be honest.
Okay. And Warish, yourself?
Yeah, obviously, to echo what Susan said, you really do have to work at being impartial, particularly when you're doing news coverage. And even if you're lucky enough to be offering an analysis or comment, I think you, generally speaking, are better served by, you know, on the one hand, on the other hand approach, which hopefully, you know, covers all the bases. But I do have to say, I have some hobby horses, and I have to admit that if you came to me with an idea to write about some of these hobby horses, I'm already very interested, and I'm already planning that might be my next column. So, for example, it was mentioned earlier about the battle analogies, you know, the war analogies. I have a huge thing about how destructive it is for cancer patients to be forced into this mode, you know, because unless you're someone who's normally is a fighter and a get up and go, it's very hard to fit into that. And I think you can end up feeling that you have failed, you haven't sort of risen to this, you know, you haven't gone over the edge of the trench and faced the fire, you know, so that's one thing. The other thing I've always been fascinated with for a good few years, even before I went to journalism, is placebo and the placebo effect. And I better be careful now if the medical counsellor are listening in, but certainly, how will I phrase it? If I had a way of you know, reframing our ethics a little bit, I probably would open up the prescribing of placebo a bit more. I think there's evidence there, and I think there's you can do it now, and there's evidence that you can actually tell someone that you're giving them an inert pill and it still does them good, you know. So anyway, that's me and placebo. What other ones are there? Gosh, anyway, that's a flavour of my my hobby horses.
Okay. So Kira has put in a comment to say that the public have really got engaged in COVID-19. And there's been a big appetite for understanding the disease, the science behind the disease, and really getting into the detail and understanding it. And she's asking, is there an opportunity there for the public to continue to engage in health matters and health issues when COVID finishes? I might go to Susan for that one.
I think there's definitely a potential for it, but I think that COVID in some ways is quite unique in that, you know, it presents, you know, completely, for us anyway, in the Western, for most of us, we've never experienced anything like this before. It's completely upended our way of life, our way of living, socializing, our interaction with family members in a way that for most of us, unless we're actually directly hit or affected with the disease ourselves or in our own immediate family, we've never experienced before. So will COVID change people, and you know, will the public continue to be as invested in healthcare or the health service afterwards? I'm not sure, to be honest, that they necessarily will, because I think that when this comes to an end, people will breathe a sigh of relief and to some extent, you know, go back to normal. But But I do think, just to build on a point that Murish made earlier, is I think that people have seen the health service by and large working very effectively at the moment. And I think that there has been a lot of positive coverage, and deservedly so, of how things have been dealt with and how they have been managed. And I'm not trying to sugarcoat anything. I know that there have been issues in nursing homes, etc. But by and large, our response, the impression the public has, is that our response has been very good. And so I do wonder whether that will change. I think in the past that the HSE as an entity has really suffered a bit of toxicity in terms of its brand that we never saw with the NHS. And I remember Tony O'Brien, the former HSE chief, saying this to me, when the Olympics took place over in the UK, like, they had the NHS branded out there. Never here with the HSE. It's just a completely different beast. And I think that maybe there might be more of an appreciation for the health service as a whole after this, but I'm not sure it will change the extent to which people are invested.
Okay. Murish, would you like to come in on that point?
Yeah, just to say, I absolutely agree with what Susan said, but maybe the public can be encouraged to continue their engagement, and that might be a big leadership position for the HSE to take, because I sometimes sense there can be quite a gap. Even with patients who are in the system, there's often a gap at various points in their treatment or their journey. And sometimes I feel that there's almost a need for, if we had healthcare concierges, who would actually connect the bits up. But I definitely think you could build on the public interest. Very much, it's definitely an opportunity, but it probably is one that needs to be moved and incorporated relatively quickly. But then who's to know? I mean, it's not looking like COVID will be gone by the end of this year. So, there's time for a bit of planning and people to get into that.
Okay. I just have a comment in from Deirdre just on that theme of the vulnerable groups, and in particular the elderly population and what's happened in nursing homes. And we were talking a little bit earlier before we came on air about cocooning. Is there an ageist agenda within the media, do you think?
I don't think so. I understand why that question was posed. I suppose one of the things, when you attend a press conference, as I have done, there were daily briefings. Every single briefing, we were told there have been X number of deaths, of which, X had, other comorbidities, etc. And we have, constantly been told that most of those, who have died were over 80, etc. Probably Miriam asked about language. Some of the language that we in the media have used, the elderly opposed to older people, etc., has maybe been discriminatory. But I don't think that there's an ageist bent. If anything, I actually think that there has been a lot of distress about what has occurred in nursing homes, and understandably so.
Okay, so I just have one quick question then for Murish, and then one final question for yourself, Susan, if that's okay. Murish, Marina from NOCA is wondering, she was really interested in what you said about giving the story back to patients. Could you just say a little bit more about that?
Okay, so in practicing or encouraging narrative-based medicine, you are first of all listening very carefully and encouraging the person to tell their story. But when you move into the area of actually using the story a little bit more therapeutically and to help the person, then you have to, by keeping this bridge open, but at the same time you have to formulate a number of things around that story, which might influence some of the clinical decisions that you would choose to put in front of the patient. So it's just as part of that process, it can be very easy. So a classic example would be if an interesting patient was presented to a conference, a hospital conference, and their story is told on their behalf. That story at the end of that conference can adopt a completely different colour and even importance and emphasis after that process has happened. And it's just to be aware that you do need a certain amount of humility around the whole patient story and a recognition that, you know, and maybe what it needs is to go back to that person and say, look, we discussed your case in at a conference, but this is what we what emerged, and you know, what do you think of that? You know, it's joining, it's completing the circle really, and there's a lot of instances, a lot of examples of that. With someone with chronic illness, if you've had a successful narrative interaction with them, often they still have their chronic illness, they still have their pains, they still have all the aspects of it, but they develop a certain ease is probably the wrong word, but a certain accommodation with their illness. But then sometimes things go slightly out of kilter again and out of sync. But again, if you're narratively aware and tune into that, and by sharing your views and thoughts with the patient, very often you can get them back on track. And it's very interesting. It's not curative, but it's certainly really excellent care when that happens.
Okay. And Susan, finally to yourself, as a strong female leader, what would you say to somebody taking on a leadership role within the health services now? What advice would you give them?
One of the things that I think that I've seen over the last couple of months with COVID is many more scientific and medical voices out to the fore. And I know that hasn't always worked brilliantly. There's some criticism, say, from public health doctors, and others have been stepping on their turf and that kind of thing, and, you know, calling for people to stay in their lane and etc. But by and large, I think it's great to have so many experts out looking at different subjects. And I think that that's something that I'd love to see the HSE do more of. Many of their own communications are very structured and sometimes, I suppose, reactive to, you know, a trolley crisis, and someone is wheeled out to try to explain why, you know, there's 400 people on trolleys on a given day in winter. And I think that I'd probably advise them to be actually much more proactive in terms of their communications, and also to be more transparent about the huge challenges that there are in the health service, because people understand. And that would be, I suppose, the one thing where I think that they maybe fell down a little bit just in terms of COVID, that there was an effort even at the start to say, you know, oh, there's no problems with PPE, we've lots, there's plenty, we've an adequate supply until, you know, forever, which wasn't the case. And I actually think people would have really understood if they had just come out at the start and said, look, this is unprecedented. Of course we don't have, you know, 100 or 200 millions worth of PPE stored out in City West or whatever else, but we're doing our best, you know. And I think that they need to be more confident in themselves, or that, you know, I'd like to see the next manager be more confident in themselves about just communicating those realities and challenges openly.
Okay, that's over and out from me. I'm going to hand you back to Caroline now. Thank you, Caroline.
Sorry, Caroline, your microphone's on mute.
I'm muted. Sorry, I was muted. That was really fascinating. I was just asking the question, can we stay on for another half an hour? So many more things I'd love to talk about. But Very rich, fantastic discussion, lots of amazing learnings and a lot of similarities between both of our expert panel in terms of their story and what they'd recommend for the future of our health services in Ireland and the lessons that we have learned through COVID. And I liked when Susan was talking about from a communication perspective and the challenge of the number of articles during COVID that were being published by medical journalist papers. And for her, her own approach was actually to sit back and wait and then conduct the interview herself. And even in terms of communications, the importance of bringing the public with you and how the HSE got that right and the government got that right. So the HSE leaders, we've all seen this, got amazing buy-in from our public, and the importance of language and the examples given of some of the Western leaders using very warlike, strong men leadership models. And New Zealand took an approach that they weren't going to do that because it instills fear and negativity. And then, of course, the Trump classical point and the impact that that had right down to Susan on a personal level, because it impacted on her family and the questions that she had to answer out of quite a flippant comment. And then also, I suppose, our own national media and how RTE were doing a fantastic job and brought all of our politicians in, Leo, Simon, Paul, Tony Houlihan, they were all given, and Colin, they were given time to explain. And I think that was really important for communication. And from a leadership point of view, Susan talked about some of the insular leaders across Europe and at the very beginning how they weren't prepared even to share PPE with other member EU countries. But Ireland did okay and into the future, and that our Chief Medical Officer did an absolutely brilliant job from a communication point of view. And some of the advice that Susan would give into the future builds into what Murish said, and he talked about narrative medicine and about the importance of the patient story, and that journalism is the first draft of history, absolutely, without a doubt. And that it is really important to listen to what the patient has to say. And I loved the example of, in the absence of CT scans, MRIs and very fancy medical technologies that are available now, that listening for a doctor or GP provides 80% of the diagnosis and then 10% in relation to the examination, and how that the young medical students, I suppose all of us are quite seduced by technology, but that's something to watch out for. And that if he was to give any advice, it's around active listening, and that the story belongs to the person. And also not to interrupt the patient and not to translate your interpretation of what they have said. And then both our expert panel members said if they were to give advice to our nation going forward, that the HSE, and I liked the example because I do remember this when Tony O'Brien was CEO, the Olympics example around the NHS having a brand. I think it's fair to say, and we said it to Paul Reid, and we've seen it on other media coverage, that it's fair to say that the HSE has got a good shout out, and rightly so. So I think the public are very proud of our leaders and the jobs that they've had to do in very extreme, unprecedented circumstances. So some of the practical stuff that you talked about, and Paul Reid said about unlocking lots of the bureaucracy to let people just get on with their job. Michael West talked about the softening of hierarchies. Moore said about the whole OPD planning and how that may be maybe not so necessary. And Susan said, and I think this is really important, that HSE needs to do more communication and in a proactive way rather than a reactive way, and be very transparent around the huge challenges that we all face, and so much more. Pages of notes again. So I'm conscious of time, and I want to really thank gratefully our panel of expert speakers this evening. We really do appreciate you taking of your time to talk with us and to share your insights, which are hugely valuable, and the importance of telling your story. And we heard the importance of storytelling from a learning point of view and for gathering history. So next week we are being joined by a very different conversation that matters. It's the last of this series of conversations that matters. It's happening next Thursday on the 25th before we take a break for the summer, and we'll be joined by a bunch of lively artists and musicians to tell us about COVID-19 from their perspective. So a lady called Ruth Ma Gibber and a lady called Grania Hope will be joining us. So we're looking forward to that. And finally, can I draw your attention to a sponsorship opportunity for women seeking to advance their leadership development? We have applications which are closing on the 30th of June, and for more information, if you could contact leadership@rcsi.com. So I would really like to thank our panel again, and I'd like to thank our listeners, and I'd like to thank all of the team who work relentlessly behind the scenes to make this happen. And a little bit of a special shout out now to Siún, who drove and saved the day. So thank you, Siún, wherever you are, and thank you, Susan, and thank you, Murish, thank you, Miriam, and thank you, John, and thank you, Tina. Good night. Thank you.